The use of rehabilitation technologies such as robots for treatment of patients is a hot topic these days. But the question is, can they take over the role of a physical therapist in the future? To find the answer, watch the video. Hi, in this video I'm going to talk about the most commonly used robots for upper limb rehabilitation that are a complement to the conventional therapy. Let's start with a brief introduction to the history of rehabilitation technology. The first technology institute was in the late 19th century in Stockholm, Sweden, the Gustav Zander Institute. Like in old days, most of the techniques were they were using BOBAT, the neurodevelopment technique, in which all the treatments were hands-on and they were hesitant to use the technologies and rehabilitation technologies. The rehabilitation technologies and robots were an evolution in the treatment of patients. The pioneer or the first robotic device which was serving a therapeutic purpose was in 1991 in Massachusetts, the MIT Manus. MIT Manus was an end effector, and nowadays it's called in motion. Why is it called an end effector? Because only the hand is working on with a handle, and the shoulder is not directly in touch with the device. That's why it's called an end effector. So the patient can play various games, and they interact with the handle. What are the key factors for recovery? The first one is the intensity. The intensity has to be according to the patient capabilities. It should not be beyond or less than their capabilities. The repetitions and the frequency has to be progressive. The psychological factors such as the motivation, the feedback and feed-forward mechanism, and task specificity and variability are the key for the recovery of the patients. Let's talk about the types of robots. The types of robots can be end effector, as we see in MIT Manus. The end effectors are easy to wear, but they have a limited range of motion, and you have to be careful about the compensations that the patient might do. They might not have a good posture, and they might do compensatory movements. The examples of end effector, as I mentioned, is Amadeo, Tyromotion, and the MIT Manus. The second type of the robots are the exoskeleton. Exoskeleton, as it sounds, it's an external skeleton, so it controls the joint torque and it has a higher range of motion than end effectors. The example is ARMEO spring, the company Hokoma, and actuator and non-actuator devices. Actuator means the use of an external power or a motor, but non-actuator doesn't have a motor. So ARMEO power is an example of the actuator robots. Okay, let's talk about the products of the company Hokoma. Company Hokoma is based in Switzerland, in Zurich. The products that they have are the ARMEO power. ARMEO power is an actuator. It's grounded exoskeleton. ARMEO spring, it's non-actuator, meaning that it doesn't have a power or doesn't have a motor. And it's a grounded exoskeleton also. ARMEO Pediatrics is a small version of the ARMEO spring, and ARMEO boom and ARMEO sensor. In the next slides, we will talk about the different types of the Hokoma products. But first, let's see the indications of the ARMEO. In which conditions can we use the ARMEO products? For stroke, for traumatic brain injury, for spinal cord injuries, for pediatrics disease, for multiple sclerosis, the Guillain-Barré syndrome, amyotrophic lateral sclerosis, and humerus fracture recovery. As you know, in this video, we're going to talk about the use of robots for the upper limb. So all these products, the ARMEO products, are used for treatment of the upper limb. So the first product is ARMEO power. ARMEO power is actuator and is grounded exoskeleton. So it has an external assistant, it has a motor, it helps the movements, it has 6 degrees of freedom. The movements that you can do are shoulder flexion, horizontal abduction, horizontal adduction, internal and external rotation, and but shoulder extension is not allowed. The use is for severely impaired arm, and it has an extra item, the maneuver power. So the maneuver power allows the use of exercising the hand and the wrist. Next products are ARMEO Spring and ARMEO Pediatrics. They're the same, but it's just about the size of them. ARMEO Pediatrics is a small version of the ARMEO Spring. They are both non-actuator, meaning that they have no motor. They are grounded exoskeletons. They are for moderately impaired patients, for moderately impaired arms, whereas the ARMEO Power was for severely impaired patients. It's equipped with a library containing many games, and as you can see in this video, like they have to find a different color apple, and this game, they have various types of games they can play. So it's by way of playing, they are doing the rehabilitation. And ARMEO Pediatrics is designed for children between 4 to 12 years. So the ones that we talked, like the ARMEO Power and ARMEO Spring, they can be used in clinics and in hospitals, but ARMEO Boom is designed to practice and train at home. So they have an overhead sling suspension, as you can see here, to support the arm against the gravity, to eliminate the gravity. And they allow 3D non-immersive games, so they can play. And it was developed by the work of University of Twente and Enschede in the Netherlands. So it is designed for mild, impaired arms. Like ARMEO Boom, ARMEO Senso is another product. They're also designed for practice at home. They have actually a hand module, as you can see here, and they have 3 modules, 2 on the arm, 1 here, 1 there, and 1 on the chest, which we cannot see from this position. And it's also designed for mild and moderate arm impairments. So these are games-based devices. So the sensors equipped in the modules can detect the movements, and with that they can interact and play the games. Alright, so far we talked about the products of the company Hokoma. Now let's talk about the company Tyromotion. The product is called Amadeo, and Amadeo is an end effector because only the fingers are connected to the iron bars by magnets, as you can see. By magnets they are connected. And the modes, the treatment modes are active, passive, and vibration. Active meaning that they voluntarily work, the device doesn't help. Passive meaning that the patient doesn't actively work and the device passively moves the fingers. And vibration, vibration gives proprioceptive input to decrease the hypertonia, the spasticity of the fingers. So the possible movements are for finger flexion, extension, thumb adduction, and abduction. So in conditions such as stroke, in which patients have severe spasticity in their arm and hand, it's a very good tool to use. Okay, next device is called Pablo. In Pablo, you can either use a ball or a stick, as you can see in the video. So they are equipped with dynamometers. So as the patient squeezes, the device detects the squeeze, and it can be used both for assessment and treatment. For example, you can assess the force of the hand by the dynamometers, or it can be served as a treatment. The possible movements are pronation, supination, wrist flexion, and extension. It's also game-based. Next device is called Diego. With Diego, you can use a virtual reality, or you can they can see the game on a small screen. So for this device, they use Velcros to support the arm to eliminate the gravity, and the modes of training are active, assisted active, and passive. Yougrabber enables bimanual training, meaning that both hands can be trained at the same time. So basically, patient wears gloves, which are equipped with magnetometer, accelerometer, and gyroscopes, so it can detect the position of the hand and wrist and the speed. And it detects the fingers movements and wrist movements, and they interact and they can see on the screen, and they play games. So it's very good for arm and hand therapy. It's a very good and affordable tool. This item, the company Decinti, I don't know if the pronunciation is correct or not, it's a French company. It's based on the concept of the mirror therapy, but in a smart way. So they use a virtual reality. They do not see the affected arm, but they can see it on the screen. So the device takes a video of the hand, and they can see that the affected arm is moving on the screen. So this concept, when you see or when you think about the movement, it activates the corticospinal tract. So it really helps with it improves the motor function. So by just viewing and just thinking about the movement of the affected arm, the patient can really improve. So it's a product of this company. The company Tyromotion has another product. It's called Myro. So Myro is a huge tablet, and it's equipped with lots of games. So there are different tons of games where you can put objects, you can draw something, or you can complete the steps. It not only helps with the recovery of the arm and hand, it also triggers the cognitive training for the patients. It's a huge tablet. Alright, next item is called Bimano Tract. Bimano Tract was developed in Germany. The modes of training are unimanual, bimanual separate, and bimanual cooperative. What does it mean? So we have two handles, as you can see in the image, and the patient can train unimanually, meaning that they only move one handle. It can be bimanual separate. So, for example, one hand does supination, the other one is doing elbow, wrist flexion or extension, or bimanual cooperative, meaning that both wrists do the same movement. And the possible movements that the device allows are pronation, supination, wrist flexion, extension, and passive mirror principle. What does passive principle meaning? For example, you can move the left wrist, and the right one will follow automatically the movement. It's called the passive mirror principle. Okay, we discussed the most commonly used robots for the treatment of the upper limb, but let's discuss the pros or advantages of these rehabilitation technologies. They are extremely time-saving, meaning that in a clinic, several patients can work at the same time. So like in conventional treatments, the therapist has to devote all the times to one patient, but with the rehabilitation technologies, several patients can work at the same time. So it allows intense training. So the intensity can be adjusted, and in most of the devices, the device gives a feedback, and you can see the gradual, you can over the time can check the progression of the patient. More repetitions are allowed, and you know, the one of the factors of neuroplasticity is repetition. So more repetition means more improvement. It allows higher duration of training because they are motivating, they are not boring like conventional therapy, and it allows higher duration. As I said, it gives feedback and variability by different types of games. It has variability. If it's always the same, the patient will not progress. But on the other hand, let's see the disadvantages. These tools and the maintenance cost an arm and a leg. They're really pricey. The size, they're not designed for small clinics. They're really spacious, some of them, such as ARMEO Power. And sometimes it might be boring, like ARMEO Spring. The games might be boring.